Welcome everybody. Thank you again so much for joining us today for our third and final webinar in this series. We are very excited to have a great group of speakers today, and I will be introducing them here in a moment. For this webinar, just a reminder that your camera and speakers are off, so we cannot see or hear you, but we strongly encourage you to use the Q&A box for your questions, and we'll have some time at the end for questions, and then after the session for about a half an hour later, we'll stay on for discussion, engagement, and questions as well. If you have general comments, make sure in the chat box you select all panelists and attendees so everyone can be involved in the conversation. And we are absolutely thrilled today to welcome our 4 fantastic speakers who will be sharing their studies on engaging community, patient, and clinical partners to enhance prenatal care for Latinx and Black women. I would like to acknowledge the funding source for this webinar series. This is funded through the Patient-Centered Outcomes Research Institute, PCORI, on an engagement award. I am the moderator for the session today, Kelly Rickman. I'm an associate professor in the Department of Epidemiology at the College of Public Health at the University of Iowa. And you can find my email on that slide, and please reach out if you have any questions, comments, or concerns. So without further ado, I'm gonna introduce our wonderful group of speakers. First up, we have Venice Curry. She has harnessed her background as a medical professional to develop solutions for communities of color adversely affected by health and wealth disparities, environmental racism, and political disenfranchisement. She is coordinator for the Fresno County Civic Engagement Table, a community-based organization working collectively to increase voter engagement, build civic capacity, and create policy and systems change to address social injustice and health inequities. And she's also the director of the community engagement for the Embrace study that they will be talking about today. Next will be Fabiola Gonzalez. She is the executive director of the Fresno County First 5 program. And in her role, she advocates for families with young children to have what they need to thrive at home, work, and in their communities. In her role at First 5, she has leveraged public, private, and community partnerships to better meet the needs of Fresno County's families with young children. Third up will be Miriam Kuppermann, who is a professor of obstetrics and gynecology and reproductive sciences at UCSF. And she has been leading comparative effectiveness trials of obstetric and gynecologic interventions for over 2 decades, focusing on informed decision-making and patient-centered outcomes in socially and demographically diverse populations. And as Director of Prenatal Interventions for the California Preterm Birth Initiative at UCSF, she oversees a portfolio of studies focused on racism as a root cause of preterm birth. And she's a dual PI for the PCORI-funded study she's going to talk about today, the Embrace study for engaging mothers and babies and reimaging antenatal care for everyone. And then our last speaker for today is Brittany Chambers, who is an assistant professor in the Department of Epidemiology and Biostatistics at the California Preterm Birth Initiative at UCSF. And her work focuses on partnering with Black communities to understand how interpersonal and structural racism impacts Black women's reproductive outcomes, to inform policy and community and individual level interventions to optimize the reproductive health and well-being of Black women and families. So I will now turn it over to our speakers.